Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart, Life as a Dad and a 35-year cancer survivor, available on Amazon. There are a couple of parameters, expectations, and definitions that I need to begin with this post, and I will go right for it. Medical gaslighting occurs when healthcare professionals dismiss, minimize, or invalidate a patient's symptoms and concerns. Hypochondria is an emotional condition characterized by an excessive, persistent, and unfounded fear of having or developing a serious medical issue. Now that I have set the definitions, you can understand where I'm coming from. I have been blessed most of my life with not just having the proper care for everything I have to deal with, but for having the right doctors. My personality helps as well in that my doctors know that I do not reach out to them unless something is definitely wrong. My primary care doctor of nearly 40 years normally only saw me once a year for a seasonal allergy shot. So when I showed up one day with huge blisters, itching and painful, even the administrators knew it was something serious. But in recent years, and perhaps not so recent, something has been happening to medical care in the United States, and it's not been good. It's been bad enough that costs of both the healthcare and insurance continue to climb, a la profit over patients. It's unthinkable that access to doctors, lack of availability, often unable to schedule an appointment in less than a year is now the norm. Insurance companies now determine what care you can have, often based on AI. And then there's the hierarchy of care, something I know I struggle with. Unable to see the doctor, you can see any one of their underlings. A physical assistant, a physician's assistant, a registered nurse, certified nurse, nurse practitioner, and more. All who have less experience than the one you need to see, the doctor. They give responsibilities to these lower levels of care, by the way, as well as less pay, to justify their value of the appointment. But clearly, if you have something seriously wrong, you need the best care available, not follow the time-consuming steps to reach the pinnacle, the doctor. Now, for those deeply entrenched in the medical world, albeit unwillingly, there's a phenomenon making medical care even worse when it happens: medical gaslighting. Gaslighting is a form of psychological and emotional abuse where a manipulator distorts the truth to make someone question their own memory, their perception, or sanity. In fact, this was made into a 1944 movie titled Gaslight, starring Ingrid Bergman and Angela Lansbury. It's a black and white movie for you kids. That was before color films came along. That is actually still kind of stressful to watch. But at the end of the movie, you totally get what gaslighting is. So how does it apply in the world of medicine? The answer should be it shouldn't. Now imagine you're a patient dealing with a chronic illness or disease such as cancer. In dealing with any medical situation that you are so far away from feeling healed or recovered, it is not uncommon for us to let our caregivers know when we are dealing with potential side effects or not feeling well. Instead, the patient is made to feel that how they are feeling is all in their head. The medical person does not seem interested in pursuing the patient's concern, not asking follow-up questions, or worse, deflecting away from the problem. This is medical gaslighting. I need to be clear. I've never personally experienced this myself as a patient, but I have seen it firsthand as a caregiver, and it's horrifying to watch. Worse, it delays the actual diagnosis, leads to inadequate treatment. The biggest concern, the patient develops a loss of trust in the healthcare system and the provider. It's all in your head. You're just looking for attention. You're just hormonal. It comes along with getting older. You're overreacting. Because if the medical caregiver is successful with their approach, the patient walks away not only not treated properly, but feeling an excessive anxious condition called hypochondria, having a fear that something is wrong despite little or no supporting medical evidence. But there's a huge difference between having a fear that something is wrong and knowing something is wrong. And if a patient is being gaslit medically and the patient knows full well something is wrong, feeling like they are a hypochondriac incorrectly can be a fatal response. And I'm willing to admit, especially as a long-term cancer survivor, not everyone in the medical world knows about us and the many issues we face. And until a couple of decades ago, we were barely recognized because we weren't expected to live this long to develop these late side effects, which of course were not researched. But if you're dealing with as caregiver who lacks that knowledge and instead blames the patient, that is medical gaslighting. Now, this is not to say that hypochondria is not real. It most certainly is. But when it is created in a patient because someone trusted for necessary medical attention does not have either the necessary skill or education, and then treats the patient as if their situation is not real, that's a real problem. And I'm very open about my medical history. I have a list of diagnoses a page long. I could not imagine, as I'm dealing with yet a new symptom, my last video I talked about it, I'm still wearing this heart monitor, being told it was nothing or it's in my head. Those who have cared for me know that I'm struggling with recognizing symptoms as it is. But just because I have frequent flyer miles in the medical community, blow me off with a symptom once, and I will ignore them every time they come up. And that could be a fatal judgment. My advocacy is always for the patient and survivor who deal with these weird anomalies. You know, the kind you would see in the old TV series House. Just because the patient doesn't meet the metrics for age, for the symptoms, or happens to have a lot of stuff wrong with them, especially through no fault of their own, like treatments used to save my life from cancer and the late effects they have caused me later in life. Trust me, while I respect and appreciate every minute I get with my medical team, neither of us want to be in that exam room. But for now, I know I have care providers that will not gaslight me. The same cannot be said for many of my fellow survivors, however. All is not hopeless. There are things that can be done if you are being gaslit. It's unfortunate, as you likely have enough on your plate that you need to advocate even harder to be taken seriously. It always helps to have a caregiver or a second set of ears at your appointment because, as a patient, there's always the risk you won't hear everything you need, but instead that caregiver will now be a witness as well as an advocate. Document everything either in writing or recording with your cell phone. You do need to let them know that you're recording them and state that it's only to remember details of the appointment. Seek a second opinion. No doctor should ever be offended or upset by this step. And best case, nothing found, and that is good. Worst case, something does get diagnosed and you get treated. Request documentation from the doctor or provider to note in your chart the refusal to run a certain test or treat. Doing so might force them to reconsider. It's easy to take medical gaslighting personally, and you should, but the ire should be directed appropriately to the corporate ways and procedures dictated and insurance guidelines that are now directing our medical care. I don't believe for 1 minute that any provider, from nurse to doctor, is malicious or manipulative. But unfortunately, they simply may not have a choice. I want to be clear. I don't know all the ins and outs of how medical practices and specialties work. And I've been blessed, as I said, to have providers that do not blow me off or dismiss me. But I'm now experiencing the difficulties of seeing the level of care I need, instead to have only available lower levels of providers who, I want to be clear, I have the respect for. But in the end, I'm getting charged the same as if I were seeing the doctors, and the insurance companies are still seeing the profits hand over fist. Rather, profits over patients. But that's another post. As always, I welcome comments on this video. I know I have several doctors and nurses who follow me. If I've said anything, please correct me in my comments. If you feel there's anything that should be added, please put them in the comments. Until next time, this is Paul's Heart.